So I'll perform hand hygiene. And I'm going to introduce myself. Hi, my name is Casey. I'm a student nurse. I'm going to be providing trach care to you today. And I would make sure I could visualize his armband and read his name. Hello, Mr. Stroop. And I would establish a method of communication, whether that be if he was conscious and could speak. That would either be with like a chart that he could write on or point to different words, or he could motion or mouth what he wanted to say. I'm going to assess the need for tracheal suctioning, such as if he had secretions that he could not clear on his own. I'm going to explain the procedure. Okay, Mr. Stroop, so I'm going to be suctioning your trach, and we'll be removing the dressing and changing the inner cannula. And I'm going to apply the pulse oximeter just so I can monitor his oxygen level throughout. I would provide for privacy. I'm going to prepare a work area and find a trash bin close to my work area. I would perform hand hygiene and put on gloves, and I would adjust the bed to working height. I would make sure the patient was in a correct position, like semi-Fowler's, which she is in. Okay, I would place a towel across his chest. I'm going to check his source of oxygen, which would be up here on the wall. I would verify the flow rate and make sure that it is correctly flowing through the tubing. And I would go ahead and unsnap one side of the trach collar. I would check the suction equipment, which would also be up here on the wall. I would make sure, I would set it to the correct suction level, and then I would take the end of the tubing and touch it to my finger so that I could feel it was suctioning correctly. And then I would make sure also that this tubing was within reach so I could grab it quickly. I'm going to remove these gloves and perform hand hygiene. Okay, I have my sterile suction kit right here, which I would open. I'm going to grab this cup out, only touching the outside. I'm going to put that right here. I'm going to lip my sterile saline and then pour some into the container. At this point, I'm going to apply my mask. And my gown. I'm going to this would already be open because my sterile gloves would have come out of here, but obviously wasn't right now. But it would have already been open. I would not contaminate my sterile gloves. So with my dominant hand, I'm going to pick this up, and with my non-dominant hand, I would attach this to the suction valve. I would go ahead and, this hand, by the way, is now contaminated. I would go ahead and dip this into my sterile saline and check to make sure that it was suctioning correctly. I'm going to go ahead and, like I said, test the suction. I'm going to, with this hand, now that this is connected, remove the trach collar. And I'm going to go ahead and insert this into the tracheostomy without applying suction. And I would suction no longer than 15 seconds with each attempt, and I would rotate and intermittently apply suction, and I would suction no more than 3 times. I would clear this with any secretions by dipping it into the sterile saline, and I would assess Mr. Schrute for the effectiveness of suctioning and maintain sterility between attempts. I'm going to reapply the oxygen source for at least 30 to 60 seconds between each pass. I'm going to encourage Mr. Schrute to take some deep breaths and to cough. I would be watching that pulse oximeter and monitoring him for signs of hypoxia, such as if his oxygen saturation dropped. I would also be paying attention to his respiratory rate and heart rate. Now that this is complete, I would disconnect it from the suctioning source, and I'm going to remove my gloves. And I'm going to dispose of these. And I would turn off suction. I'm going to perform hand hygiene and clear my area so that I can get ready to clean the trach. Okay, I'm going to open this kit. I'm going to lip my sterile saline and then pour some into my basin. I'm going to put on clean gloves again. I'm going to remove my oxygen source and remove the inner cannula and this site dressing because it would be soiled at this point. I'm going to remove these gloves perform hand hygiene. I'm going to put on my pair of sterile gloves. Okay, so I'm going to don my sterile gloves. I'm going to pick up this sterile inner cannula and insert it into the tracheostomy tube. And I'm going to make sure the patient is comfortable and try to prevent trauma. I'm going to dip the applicator into the sterile saline and clean the stoma, and then dry with the sterile gauze. I'm going to place my new tracheostomy dressing under the trach holder. And then I would change the trach holder, utilizing technique that would prevent it from dislodging, and I would make sure to check the tightness. Then I'm going to replace the oxygen source. And position the patient so that he's comfortable. Are you comfortable, Mr. Shrew? And he says that he is. I'm going to clean my area, remove my gloves, and perform hand hygiene. And I would make sure to document all care given.